direct pathway, indirect pathway, Parkinson disease, and other hyperkinetic disorders. Do all these names get mixed up just before your MBBS exam? Don't worry. In the next 3 to 5 minutes, I will help you remember the entire basal ganglia chapter using one simple flow chart and one memory map and a few powerful tricks that you will never forget. And stay till the last slide because I will show you one memory map that can help you revise the entire chapter in less than 1 minute before entering the examination hall. So let's begin. Think of basal ganglia as the brain's movement control room. Here's the first memory trick. Caudate plus putamen is called as striatum, whereas putamen plus globus pallidus is called as lentiform nucleus. That's all you need to remember for the anatomy. Now let's look at the highlighted note. The striatum is the main input station. Whenever the cerebral cortex sends movement information, it first enters the striatum. So simply remember, striatum is a starting point. That's enough for most of the university questions. But what exactly this control room trying to achieve? That's our next slide. Basal ganglia has only three important jobs. First, start the movement, stop unwanted movements, and smooth and fine-tune the movements. Now remember the two important neurotransmitters. Glutamate, green color is go. Glutamate excites the neuron. It is excitatory neurotransmitter by opening sodium and calcium channels. GABA is inhibitory neurotransmitters. Remember, red is stop. It hyperpolarizes by opening the chloride channels. One clinical pearl to remember: basal ganglia perform automatic movements so that your cerebral cortex remains free for thinking and planning. Now let's understand the most confusing part of this chapter in less than 1 minute. This single diagram explains almost the entire chapter. Here is the easiest trick. Direct pathway is drive. It promotes the movement. Indirect pathway is inhibit. It suppresses the unnecessary movement. Now comes the dopamine. Dopamine acts like a smart traffic policeman. It supports the direct pathway and reduces the indirect pathway. So dopamine always helps the movement. One simple line for exam. Direct pathway is the accelerator. Indirect pathway is a brake. If you remember only this, Parkinson disease becomes very easy. So what happens when dopamine disappears? Watch next. Parkinson's disease occurs because neurons in substantia nigra gradually degenerate. So less dopamine means the accelerator becomes weak and the brakes become stronger. That's why the movements become slow. That is, the loss of substantia nigra neurons create relative acetylcholine dominance. Now, let's remember the four classical features. TRAP, that is tremor, rigidity, akinesia or bradykinesia, and postural instability. Think of a patient who moves slowly, walk with tiny steps, and has a resting tremor and stiff muscles. That's the Parkinson's. If you are preparing for viva, pause the video here and try recalling all four signs before I continue. Now the most common university question: Parkinson's treatment and physiology behind it. Why don't we give dopamine directly? Because dopamine cannot cross the blood-brain barrier. Then why we give levodopa? Because it enters the blood-brain barrier and converts into dopamine. But why we give carbidopa then? Because it prevents peripheral conversion of L-dopa, allowing more drug to reach the brain. Now look at this comparison table. Students often confuse between spasticity and rigidity. Spasticity, the lesion is in pyramidal tract. Rigidity, the lesion is in basal ganglia. Muscle involved in spasticity are only one group, whereas in rigidity, both agonist as well as antagonist muscles are involved. The type is clasp knife type in spasticity, whereas rigidity is lead pipe or cogwheel. Spasticity is velocity dependent, whereas rigidity is non-stretch sensitive. Now have a quick trick to remember this is spasticity is a pyramid problem, or rigidity is basal ganglia problem. Remember that one line and you will never mix them again. Now let's revise every important lesion in one easy table. Here is your favorite exam table. But before moving further, remember one important key rule. There is a loss of dopamine causes hypokinetic movement, whereas loss of GABA or inhibition causes hyperkinetic movement. Now let's connect the nucleus with the disease. Caudate nucleus, it causes chorea. Putamen, it causes athetosis. Striatum, it causes Huntington's disease. Subthalamic nucleus leads to hemibalismus, and globus pallidus causes kernicterus. Now, instead of memorizing diseases randomly, simply connect each lesion with its nucleus. This table alone is enough to answer several viva questions. And finally, let's combine the whole chapter into one single memory page. This is the page that you should revise before entering your university examination hall. Let's read it once. Anatomy. Caudate plus putamen equals striatum. Tools. Glutamine means go. GABA means stop. Pathways. Direct, start the movement. Indirect, suppresses the unwanted movement. Now lesions. Loss of dopamine causes Parkinson's. Caudate causes chorea. And subthalamic lesions causes hemibalismus. If you can explain this page without looking, congratulations. You have revised the entire basal ganglia chapter. That's how you can remember the complete basal ganglia chapter in just a few minutes. If you found this memory trick helpful, watch the main video for the complete 10 marks university answer with detailed explanations. Then watch a rapid revision video to revise the whole topic in just 5 minutes before your exams. If this video helped you, don't forget to like, share it with your MBBS friends, and subscribe to Physio with New. Remember our study formula. Learn, revise, remember. I will see you in the next memory trick video. Until then, happy studying.